We start, though, with the COVID-19 situation in South Korea. It seems the country has passed the worst of the Omicron surge. However, authorities aren't letting their guard down just yet.
As a matter of fact, officials are considering deploying a fourth round of COVID-19 shots from the fall. For more, our reporter Shin Ye-eun is here in the studio with us. Good morning, Ye-eun.
Good morning.
So let's start with a local tally for today. What are we expecting?
Sure, Mok-yeon, we're expecting to see today's caseload hover at around 290,000 because up to 9 p.m. Tuesday, 281,262 infections were already reported, and this was up by more than 21,000 from the same time a day ago. But compared to last week, the number of COVID-19 infections came down by over 132,000. Now, we've seen the average daily tally for COVID-19 hover in the 270,000s over the past week. This is a significant drop compared to last month when we saw this figure surpass 400,000. Naturally, with the drop in new infections, the number of people visiting residential treatment centers went down as well. These centers have been treating patients with mild COVID-19 symptoms. Now, as of now, only 19% of all residential treatment center hospital beds are occupied, and authorities are considering no longer running these centers as a whole, especially since they've shifted COVID-19 treatment methods to be more similar to treating the regular flu. From last November, most people infected with COVID-19 have been asked to recover at home, and recently authorities have allowed everyone to receive in-person treatment for COVID at local hospitals if they want to.
Right. Now, officials are fairly confident that we won't see a second Omicron mega surge like we've just endured, but they're not letting their guard down, and their main hope of stopping this happening is another round of vaccinations for people who want to get them, and this could be in the pipeline.
That's right, Mark. In a briefing on Tuesday, authorities said they are looking to secure millions more COVID-19 vaccines ahead of the fall and winter season when there may be a resurgence in infections due to drop in temperatures. That's why authorities are thinking of inoculating more of the population with a fourth vaccine shot. And other countries have already pressed ahead with giving out fourth jabs to vulnerable or elderly people. Israel, the first nation to make a fourth jab available in December of 2021, started an expanded rollout in January this year. In Hungary, fourth doses can be given to anyone who requests one after talking with a doctor or medical staff. And currently in Korea, fourth doses, or second boosters if you'd like to call them, are being given out to those with weak immunity, seniors age 60 and up, and people at high-risk venues like nursing homes. But authorities have reiterated the importance of frequent vaccination, especially because of waning efficacy over time. And considering the limited shelf life of COVID-19 vaccines, authorities will need to get the timing right when it comes to bringing new shipments in. This comes as more than 2.3 million vaccines have had to be disposed of since February last year, and this is mainly because COVID-19 vaccines are mostly temperature sensitive and have a short shelf life. Moderna shots need to be stored in a refrigerator and can be used for only 30 days after a vial has been opened, and Pfizer shots have to be used within 31 days of them being defrosted and must be stored in a refrigerator as well.
Now, moving on to the treatment front. So we're looking ahead to more supplies. The antiviral pills.
That's right, Mok-yeon. Now that the government has secured enough supply of oral treatments, they are making these antiviral pills more accessible. Some 420,000 courses of treatment are available for use this month. From today, nursing homes and mental health hospitals accounting for many cluster infections can receive antiviral pills from public health centers. And authorities have supplied public health centers nationwide with enough antiviral pills to immediately supply to other medical institutions and nursing hospitals in need. Each public health center will receive antiviral pills from Paxlovid. That's enough to treat 100 people, and from Lagevrio, enough to treat 24 people. Now, these centers can also request more supply if needed.
Let's hope such efforts could, even decrease the number of new infections. Ye-eun, thank you so much for your report.
Thank you.